In a rare and candid disclosure, King Charles has shared his personal encounter with a cancer diagnosis, describing the moment he learned of his condition as a shock. At 75 years old, the monarch's revelation came during his first public engagement since the news broke, alongside Queen Camilla at a London cancer treatment center. King Charles' visit to University College Hospital Macmillan Cancer Center was not just a routine engagement. It turned into a profound connection with fellow cancer patients undergoing chemotherapy. The king, sharing his initial reaction to his diagnosis in February, confided, "It's always a bit of a shock, isn't it, when they tell you?" As reported by the Times of London. The king's involvement went beyond formalities. He engaged deeply with the patients despite the circumstances. Someone also asked how he was feeling that day, and Charles replied, "I'm all right, thank you very much. Not too bad." At one point during the visit, Charles mentioned his ongoing cancer treatment, speaking to a patient receiving chemotherapy and saying, "I've got to have my treatment this afternoon as well." The king appeared to be in good spirits, holding hands with the patients and greeting everyone with a smile. Before heading into the facility, Charles and Queen Camilla waved to the crowds outside. While he kept the specifics of his cancer under wraps, he openly discussed the chemotherapy experience with other patients. In one notable interaction, Charles asked a patient about using a cold cap, a technique designed to help retain hair during treatment, and remarked on its benefits. The atmosphere of support extended to the medical staff as well, with Charles expressing his gratitude to the nurses by stating, "We really can't live without you." This moment of appreciation underscored the critical role healthcare workers play in the treatment and recovery process. Queen Camilla also took an active role during the visit, engaging with patients about the side effects of their treatment, including fatigue and changes in taste, which are common among chemotherapy patients. The staff at the hospital were pleasantly surprised by the depth of the royal couple's engagement. According to one nurse, the visit exceeded expectations. "We thought it would be very generic, questions about other people's treatment." Instead, Charles was very open with the patients about how he was feeling, leading to many meaningful exchanges about symptoms and shared experiences. This personal disclosure comes at a challenging time for the monarch, who has had to adjust much of his royal duties to concentrate on his health. Despite responding well to treatment, he has faced frustration with the current state of the monarchy, exacerbated by recent health issues within the royal family. The news of his condition initially emerged following a procedure for an enlarged prostate, during which doctors identified a separate issue of concern needing attention. Buckingham Palace later clarified that the diagnosis was not related to prostate cancer, setting the record straight amidst widespread concern and speculation. As he continues to receive treatment and carry out his duties, King Charles's openness about his diagnosis serves not only as a bridge to those suffering similar battles, but also highlights the enduring strength and commitment of the monarchy during personal trials.